If you've lost your zest for life and you're just not feeling like yourself, you may have a hormone imbalance. Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine talking about this very important subject. And I was asking you earlier, do all women at some point need hormones?
Yeah, especially today, we're so bombarded by chemicals that we're exposed to every day that really disrupt our endocrine system. So it suppresses even further the body's own natural production. Of course, after menopause, the ovaries stop producing, and in men, the testes stop producing the hormones. So if you want to feel great like your youth, it's really not just a vanity thing. It's not just, okay, I'm longing for yesteryear.
Right.
It's not just, I want to have greater sex drive. It really affects reducing your risk of cancers and heart disease and osteoporosis. And you need to know the symptoms that you're looking at, or looking for, so you can know if you need to balance those hormones.
What are some of those? I was going to ask you that.
Well, there's a slide I'd like to show that lists those. So here's the symptoms. And if most women know a lot of these symptoms, but they just think they're, something they got to live with.
Aging,
so the
right.
PMS, moodiness, breast tenderness, that's low progesterone. You need to really get that fixed. Heavy periods, endometriosis, even uterine fibroids, even miscarriages. Women don't know that's a sign of low progesterone. Hot flashes, of course, that's a sign of low estrogen. Anxiety and depression, that's low progesterone, low testosterone. Osteoporosis, and low sex drive. So all those things kind of, a lot of women just think, well, I just have to get through this. It's
right.
just the way
Everyone
life
goes
is.
through this at this certain point of life.
Women
right.
don't know that if you have any of those symptoms, that means your hormones are out of balance. If you get those in balance, those symptoms go away. My patients say, wow, why didn't I know about this 30 years ago?
And they feel a lot better.
Right, exactly.
Now, what's the best way to take a lot of these hormones? I have people asking me all the time, what's the best way to take?
The best way to take them is in a sublingual capsule. So we actually have a two-piece pull-apart capsule a patient pours under their tongue, dissolves in 10 seconds, gets right into the bloodstream, has its effect. If you swallow a pill or put creams on, they just don't work as efficiently. They just don't work as well. And the injections, the pellets, they have a longer lasting effect, but you can't use the good estriol. It doesn't last that long. So you have to use one that's a little more risky. And it's an injection every 4 months or 3 months. You got to get your hormones tested every 3 months again. We need to find one that's daily. If we use a sublingual like I use, it's a daily replenishment of your natural hormone levels.
Okay, so what hormones should we be looking at? Like, should we test them all?
Yeah, I brought a slide of a patient we want to look at. Monica is a good example of this. So here's, of course, her symptoms. We talked about some of these before. She was having hot flashes and night sweats, which, of course, makes you unable to sleep. Very low sex drive. She said it was just non-existent. Moodiness, irritability, fatigue, aches and pains, weight gain in the abdomen. Those are all those imbalances of all those hormones. And in her case, we looked at her blood tests, as we do with all our patients, and we want to get these balanced. Every one of them were low. The estradiol, which we think of as the bad one, if it's too much, it can cause breast cancer. Estriol is a good one, but you got to get both of them balanced, and you see she was low in both, progesterone, DHEA, and testosterone. You get those fixed, and you see in 3 months her levels were all up to the optimal range except for DHEA. That needs a little bit more work, but in 3 months she's all back to normal, and she feels great. As a matter of fact, in 2 weeks the hot flashes are gone. Within 3 weeks she's saying, I have a sex drive I've never known before. I have sexual sensitivity I've never known before. And 3 months later she came back, she says, I have to tell you, I had an orgasm for the first time ever in my life. It's just and we think of that as just kind of maybe, okay, that's just sex drive, that's just yearning for yesteryear, but that really is important because testosterone is important for your heart. It protects your heart from heart attacks. It prevents plaque from building up in lining your arteries.
Right.
It also is a natural antidepressant, elevates your mood, elevates your energy. These are so important. And then estriol prevents cancer, progesterone prevents cancer, so we need to get those in balance. It's not just a nuisance. Women need to know this. It's more important than even a mammogram. Get your hormones balanced.
And it's interesting, too, because a lot of women go to their general practitioner and say, these, and they're like, oh, well, you're depressed. Here, take an antidepressant.
Yeah,
and that's what they think is the problem.
Yeah.
And then you walk around thinking, wow, what's wrong with you?
It's not a matter of just missing an antidepressant. You're not deficient in Prozac.
Yes.
You're deficient in these hormones that are the natural antidepressants, like testosterone. Progesterone's a natural anti-anxiety hormone. Get in balance, you feel great, and you're going to live longer.
Well, I'm sure anybody, and I'm sure anybody who saw those symptoms could relate to at least one of those.
Right.
So you have a special offer. If someone's watching who's like, yeah, that is the way I'm feeling.
Yeah, everyone watching the show, go to our website, sign up for our free newsletter. You'll automatically be entered into a drawing for a test measure all 6 of these main hormones, all 3 estrogens, progesterone, testosterone, and DHEA. We'll give a free one away to one of the lucky
Simple
entrants.
blood test?
Simple blood test. We'll find out your information. You got to know these
Really
levels.
important, especially if you have any of those symptoms. Thank you, Dr. Hansen. Good to see you
Good to
again.
see you.
So if you would like more information on Dr. Hansen, please go to his website. As we said, it's drhansen.com, or you can call the number you see right there on your screen.